I'm Azra Ghani. I'm a professor in infectious disease epidemiology at Imperial College in London. And over the last 10 years or so, I've been working quite extensively on malaria. We have a large group. Mostly what we do is numerical, so it's looking at epidemiology using mathematical models.
That's great. I am Dr. Jibola Ojikutu. I am from Lagos, Nigeria. I currently practice as a medical officer in one of our general hospitals here in Lagos, Nigeria.
So how do you think things have changed now? We have obviously the COVID pandemic ongoing.
Now this is huge. It's like COVID-19 took off the focus from malaria and other diseases, and the whole world is currently focusing on COVID. But looking at it, cases that come to the hospital now, you see a lot of severe cases of malaria during this pandemic. And it's mostly due to the fact that we all know that cardinal symptom of COVID-19 is also fever, which is what you see in malaria. And most of these parents or these adults are scared of the fact that they could be labeled suspected COVID-19 cases. So they tend to stay off the hospitals for as long as they can, till they no longer can handle the situation. Then you see them coming with severe forms of malaria, some with severe anemia, people with renal impairments from malaria, cerebral malaria, like I said earlier. It's been a huge task. It's been very, very difficult.
Yes, no, and that's one of the things we were really worried about, was not just the disruption in terms of getting nets out, which you've already mentioned is a really important part for malaria in Nigeria, but the fact that people won't come to the health clinics.
Exactly.
And the fact that we've got fever in both COVID and malaria.
Oh.
So, yeah.
So what does the latest Imperial modeling actually tell us?
Well, what we were trying to look at is if the nets don't go out as planned, and quite a lot of net campaigns are planned in Nigeria this year, then we could have quite a lot more deaths. And we looked across the whole of Africa, and in the worst case, where, for example, the nets don't go out, also seasonal malaria chemoprevention, which is important in West Africa, doesn't happen, and treatments reduced maybe by half, and that could almost double the number of malaria cases this year compared to last year. That's taking us right back to where we started really in 2000.
Exactly.
So,
yeah. And that would be a very big blow.
Yes, and I'm very worried that you'll start to see it soon, even if we don't make sure these services are disrupted. So when you see somebody coming to the clinic, when it's a child, do you think it's going to be COVID or do you think malaria? Because most of our COVID cases have been in really old people.
Yeah, for me, I first of all think of malaria because I know that it's actually endemic here. So it is safe for you to assume that the child has malaria, even if at the back of your mind you know it's possible to be COVID too.
And I think that makes sense. And the one thing that I think a lot of people forget is that malaria is treatable. And
exactly.
if you can treat a child quickly, then you'll save that life. And unfortunately, we have relatively little yet for COVID, although. But I think you make a really important point about malaria mostly being in children, and they have their whole lives to live.
Exactly.
And that's really important that we take that into account. There's so much damage done early on in life. Right. I'm just wondering, because in Abuja, you of course had a lockdown. It wasn't for very long. But do you think that had a particular impact on other diseases like malaria?
Yes. During the lockdowns, it made it difficult for people to actually reach healthcare. Now there's a lockdown on transportation. It's for a place like Nigeria where even our transportation system, road networks are not as good as they should be. So most people would rather just, okay, let me hold on at home and wait till the lockdown is lifted. And actually during that period, we actually saw a lot of cases that could actually have been treated earlier, coming in late. So I guess that's also a part of the reasons why the government tried to lift the lockdown or relax it a bit, because it was actually affecting our health outcomes.
Right, yeah, that's interesting. And are you finding that your capacity is stretched now with doctors being taken?
Yeah, definitely. Right now, it is difficult. Our isolation centers are full. We have a lot of patients that are actually still at home can't be moved to the isolation centers because there are no beds. But a lot of people are dying, especially in sub-Saharan Africa, from just malaria. It is highly preventable. And I think we should do something about it. A vaccine would be wonderful, actually.
Yes. And I mean, we do have a vaccine. It's obviously in study still, but I think there's so much progress that can be made if we all collectively put our efforts into these new tools as well.
That would actually be a dream come true.
Yeah.
And it's going to make life easy for us here. Less patients, less emergencies. Great.
It's a dream of a doctor to be out of a job.
Yeah, it is.
Yes. Yeah, I think that's going to be challenging.
Yeah, it's going to be.